Hello everyone. My name is Dr. Gaurav Panchal. I am a heart rhythm specialist. I hope you are doing well. I'm happy to take any questions if anyone have regarding their heart health or even heart rhythm related issues. Some people can get fast heartbeat, some people feel tired, exhausted, or sometimes they get shortness of breath as well. This kind of symptom indicate their heart rhythm need to be assessed. There can be multiple reasons for the same, but it is one of the important part of evaluation as well. If their heart rhythm is normal by number of evaluation, and the basic investigation is 12 lead ECG, which is commonly performed nowadays everywhere. Many doctors can do it, and that will show 6-second activity of the heartbeat, and that will be quite informative for us. If it shows normal, it means during that 6 second, electrical activity of heart has been captured. But it does not mean that rest of the 23 hours or rest of the time what is happening with the heart rhythm. And to ensure you need to capture those events, if you are having anything out of that time, then you will require another kind of test which is called long-term heart rhythm monitoring, which is a Holter monitor or a 24-hour, which can be performed for 24 hour, 48 hour, 72 hours, or even 7 days. Some people require long-term heart rhythm monitoring that can be done for almost 3 years by implanting a chip underneath their skin that can provide invaluable information about the heart rhythm if it is changing or causing any trouble. Number of people have variety of symptoms. Heart rhythm problem can happen in younger age group or older age group. Younger people can have easy tiredness, or they find their heartbeat is increasing without any obvious reason. They may find during their sports their heart rate is persistently very high, or even when they are not doing much activity, they find their heart is beating too fast. Some younger people who are in their early or late teenage group, they may find getting lightheaded or dizzy when they quickly stand up, or they find their heart rate is jumping up quite a lot when they try to do some kind of simple activities. Slow heart rhythm can be a problem in athletes who are doing extremes of sport, and that is physiological in most of these individuals. But in extremes of situation, they may sustain blackout if their heart rate is very slow, and that may require attention. When we are talking about the middle age group, they suffer with variety of health issues, including heart rhythm disorder as well. If their heart function is normal, they can still have extra beats in their heart, or they may find their heart is beating too fast or erratic at times. And most of these individuals have some kind of implication in their lifestyle that can lead to variety of problems, which could be atrial fibrillation. The lifestyle changes what people should adopt or should be ready to adopt are healthy water intake, which is usually about at least 2 to 3 liters a day for most individuals in a warm climate. It can be less, it can be more based on your activity status. Another thing to look out for is your diet and maintaining healthy body weight. If you consume good amount of stimulants in your diet, which could be like a fizzy drink, caffeinated drinks like tea, coffee in excess, or any carbonated drinks, even that can provide you enough caffeine in the or stimulants to increase your heart rate. Moreover, if you are having sugar rich food, that can drive fluid out of your system. If you are drinking too much alcohol, that can do that. But for people who already had heart rhythm problem, even smallest amount of alcohol can lead to significant heart rhythm problems. What we need to make sure that we do regular exercises, which is, if it is simple exercise like gentle walk, should be performed at least 30 minutes a day for 5 days a week at least. It should be more than that if you need to have it because of any other lifestyle diseases. Otherwise, if you perform any vigorous activity, that can be at least 15 minutes a day, at least for 5 days a week. If you require any further lifestyle modification advice, that can be tailored based on the individual requirement. Another component for middle age group is inherited cardiac condition, which many people are born with, but they come through their childhood without any major issue, because this genetic condition can manifest when we have grown up well, and this genetic condition can manifest as change in the heart shape, change in the heart function, or it can sluggish the conduction system inside the heart. When we talk about the conduction system, it is quite important to understand that heart is made up of muscles and it is meant to pump blood only. To make sure the pump is working well, it requires enough power input so that this can work efficiently. Heart has 4 chambers, and each chamber has to work in coordination with each other. And to ensure this work is happening round the clock, we need electrical circuit inside the heart. And this electric circuit, which generates the power from the powerhouse, which is called sinoatrial node, and that electricity travels through the cable system inside the heart, which is through the atrioventricular node into the bottom chamber of the heart. This atrioventricular node works as a resistance, and it is a small nodular structure in the middle of the heart. It works as a gate, and it provides the resistance to the electricity so that enough time is allowed for the bottom chamber to fill with blood, and so that it can pump efficiently. If bottom chamber cannot be filled properly, it cannot pump efficiently. And that's what happens when our heart rate increases beyond the limit when we can tolerate. And what is the limit? It is very individualized. By rule of thumb, you can calculate your expected target heart rate by a simple calculator, which is a 220 minus age. So for example, if you are 40 years old, you can have highest tolerated heart rate 180 beats per minute. If you are 60 years old, then your highest tolerated heart rate can be 140 beats per minute. If you go beyond that, it is proven by studies that your cardiac output drops. What does it mean? The amount of blood coming out of the heart which should reach out to the tissue, goes down significantly. So efficiency of your pump becomes impaired. And that is what causing trouble when our heart rhythm is a problem. Some people have heart rate going to 180, 200 or 220. Still they manage to survive well, but they have been lucky only. Or they have very physiologically well compensated system. They must be very young. The rest of the organs are in perfect order, so they can tolerate up to a certain extent. But if you carry on for long, your pump will get weaker day by day. It will pull up blood in the lungs, it can pull up blood in the legs. It will not pump blood to the brain, it will not pump blood to the kidneys, and that will manifest as dizziness or tiredness, or it can cause blackout in worse situation. If it is not perfusing kidneys properly, waste products cannot be filtered. That can alter your day-night sleep pattern. That can cause weakness. That can cause tiredness. That will eventually impact your kidney significantly. In the contrary, if your heart rate is very slow, in a similar way, it will reduce the amount of blood coming out of the heart, and it will cause more or less similar symptoms, except feeling or awareness of the heartbeat, which is usually common when your heartbeat is faster. Some people have irregular heartbeat. They feel their heart is very erratic, and that is not uncommon. It tends to beat very fast but very irregularly, and that is well known as atrial fibrillation. But we have to confirm that on 12 lead ECG to understand the heart rhythm. If it confirms the atrial fibrillation, sooner we can get back into normal rhythm, better for us. If you missed a boat for 2 days, you may form a clot inside your heart, and that can cause a stroke. So it is not easy to keep heart in normal rhythm or bring it back to normal rhythm. We need to use some blood thinners to help dissolve this clot if it may have created, before we can bring your heart back to normal rhythm. Bringing back to normal rhythm helps improve the heart pumping. It improves blood flow to the brain and kidneys. It offloads your lungs. It offloads your legs. Some difficult heart rhythm can be coming from bottom chambers of the heart, which is called ventricular arrhythmias as a group. It can be ventricular tachycardia or ventricular fibrillation in worse situations. This rhythm can kill easily anyone. We tend to look out for high risk people who can sustain this kind of heart rhythm, and that can jeopardize their living, their life. Many people who have stopped their heart can be restarted by shock therapy. Many people who sustain a cardiac arrest on the street can be revived with chest compression. But this kind of heart rhythm, once it is identified, can come back, and it is not easy to stop it coming back. Because if someone got this at once, they carry a circuit inside the heart, and this can make this circuit to come in the play once again and cause the similar trouble again and again. To improve the longevity and to improve the lifespan, this circuit can be treated. We try with medicine to suppress this, but we are not succeeding all the time. We have to utilize more than medicine. to get this circuit under control. This circuit can be easily treated and fixed to stop this happening again and again, so that everyone can achieve normal lifespan and decent quality of life. As we discussed, there are a variety of heart rhythm problems which can be coming from the top chamber of the heart, bottom chamber of the heart, center of the heart, or any corners of the heart, which can lead to variety of heart rhythm disorders, and that can affect anyone's life. And we can provide some kind of input so that we can control and come over this situation. Another spectrum of the heart rhythm issue is slow heartbeat. If our cable stop working properly, heart rate goes very slow, and these cables can be coming from the powerhouse or a top chamber, or it can be right in the middle of the junction box called AV node. If there is any problem affecting the top chamber of the heart or the junction box in the heart, we can attend this situation. There can be a good reason for this, which has to be confirmed that it is not reversible, and in irreversible situation we can always deliver a temporary wire or a permanent pacemaker to provide electricity inside the heart. This is easily performed procedure which is usually performed under local anesthetic, and usually it can be performed irrespective of the age. If you are carrying a risk of infection, then there is a leadless pacemaker, which is like a small capsule, can be kept inside the heart and provide you durable support from electrical impulses. Similar to pacemakers, we have another device called cardiac resynchronization therapy. This will provide support to the function of the heart. If you have weak heart with stretched cables inside the heart, this can be shortened by delivering a CRT therapy, which can improve the electrical flow inside your bottom chambers. That can improve the pumping of the heart, that can improve your ability to walk, ability to perform day-to-day activities. Another component to that is a defibrillation therapy. People who are carrying high risk of ventricular arrhythmias, that which can lead to risk to their life, we can provide AICD support so that they can have good quality of life without a risk of dangerous or life-threatening heart rhythm issue. There is another component to it called conduction system pacing, where we identify the cables inside the heart and provide electrical circuit to be inserted right inside that to confirm and provide enough support. That is very physiological, and that will provide good conduction throughout the heart. Some individuals who are carrying genes of having abnormal heart rhythm, that can cause sudden cardiac arrest, and that is our topic today. When life-threatening heart rhythm disorder coming and causing trouble to the heart rhythm, it can drop the circulation and it can stop the heart. And why this is happening? Many times it is noted that it happens due to blockage in the coronary circulation, which is blood flowing around the heart. Coronary arteries are blood vessel providing nutrition to the heart, and if it gets blocked, it causes this trouble. We can provide some kind of intervention that can open the blood vessel and it can improve the blood supply. If we identify this kind of problem by ECG, we can deliver treatment immediately, and this can be easily fixable issue. But there is a separate issue called cardiac arrest. If someone's heart stops, they won't have a chance to tell us that their heart has they are having any chest pain or breathing difficulty. They might be perfectly all right prior to any event, and this is called sudden cardiac arrest. And if someone dies like that, it is called sudden cardiac death. They may not have any symptoms prior to this event. They may be perfectly well. They might be chatting with their friend, or they are just walking down the street. We have seen this kind of event happening to even footballer on the ground, and they were found they were carrying some kind of heart related issue where it can lead to recurrent or repeated abnormal heart rhythm. How we can fix this? We can fix this by first of all identifying the underlying problem. Each problem requires a specific attention and very individualized care. If your heart is not having enough blood flow, which can be opened up, but if your heart has infection, which is called myocarditis, it cannot be fixed immediately. It requires a little bit longer time. You need to be in hospital for a little period of time where this infection settles on its own, but you may require support for this time being. Heart rhythm monitoring as well as medicine to suppress abnormal heart activity. Number of genes which are carrying disease provoking activity, they can manifest in diseased heart by means of slow conduction inside the electrical cables, and this can be identified only on the ECG or the heart tracing. Some individuals have spark coming from the bottom chamber of the heart, and this spark can be only identified on the heart rhythm monitor. If we find it is significantly abnormal, then based on individual, there are a variety of ways we can attend that, by giving medicine, by delivering defibrillator therapy, or by means of ablation therapy. This kind of problem runs in the family, and we don't know which family might be carrying this kind of gene, but usually we get a hint. If there is any individual who has family history of sudden cardiac death, what it means, you are perfectly well and suddenly heart stops and you are no more. If something like that happened in your family who is below age of 65, then we need to start looking for a reason why this might have happened. If there is no obvious reason, you're better off having a screening. Screening, how it is done? History, by talking to your doctor. Examination, to make sure you don't have any organ problems. Some investigations, simple tests like 12 lead ECG, Holter monitor, exercise treadmill test, and in certain circumstances, specialized tests like Ajmalin challenge test, where specific medicine delivered to improve the appearance of this disease process inside the heart, or adenosine challenge test to find hidden extra connection in the heart. This kind of heart rhythm problem can be only seen by certain specialist tests like electrophysiology study as well. It is not commonly performed, but only specialists can guide you in the right direction. Certain heart conditions, if it runs in the family, there is a good history of family related health issues and repeated events happening, but people don't know what to do about it. They may require specific tests beyond this is called genetic testing. And this genetic testing will allow us to identify and even pick specific problems inside the heart. The chances of picking up this problem sometimes cannot be very high. But if it has been identified, then it can provide us very clear direction that everyone in the family should have checked and identified if they carry any problems. This kind of problem can be monitored. It may require some specific medicine to make sure if any risk of dangerous heart rhythm problem exists, it can be easily suppressed, or they can benefit from certain therapy which I mentioned earlier, like a defibrillator therapy, or they may benefit from ablation therapy, like in certain individuals with specific heart condition called Brugada syndrome, or if they have fascicular VT, or they have RVOT VT, they can be easily treated with ablation therapy. What this terminology are? The Brugada syndrome is a conduction in the heart where the electric cables are behaving very strangely in certain specific time. They make bottom chamber of heart very irritable, and that can induce abnormal heart rhythm, and that can kill us. On the other side, fascicular VT. It is a heart condition where the cables inside the heart start behaving in an odd way. They create an abnormal connection amongst themselves, and that creates a loop cycle entry inside that circuit itself, and they start flowing electricity in a small region of the heart very fast. It drives the heart crazy, beats very fast, and that can drop the blood flow to the brain. If you carry on with similar activity for long, you carry a high risk of losing your life. International studies which has been analyzing this kind of situation for a long period of time finds that definitely medicine can help up to certain extent, but people with this kind of heart rhythm problem should have been primarily treated by ablation therapy. And what is this ablation therapy? It is a treatment of the cables inside the heart where the short circuit exists, or the abnormal circuit revolving around the heart and flowing in different direction. To make sure these abnormal connections get treated in time, we deliver a heated electrical energy which will destroy this abnormal connection inside the heart and provide a relief from this heart rhythm issue. This heated electric probe provides energy in such a graduated manner. It will deliver and destroy the tiniest amount of the tissue where it is delivered. It does not cause any damage to the any surrounding tissue. However, it has to be delivered in a graduated manner, and it requires very skilled approach to look for the signals and electricity flow inside the heart and understand the abnormal connections inside the heart. This is all done when the heart is beating, when the person is breathing, and you are wide awake. Many people don't feel any heat or pain despite delivering this therapy because heart is not sensitive to pain. However, the covering of the heart is sensitive to pain if it comes across with any foreign object. And we are delivering this therapy from inside the heart, and therefore people do not feel any discomfort. And we destroy the very specific tiny amount of tissue by millimeter. Various ways has evolved over a long period of time. The first ablation was performed for more than 40 years ago, and with evolution in the technology, we deliver therapy now with irrigated tip catheter, which delivers very specific energy in the deeper region of the heart and destroy very specific tissue only. Old era of non-irrigated tip catheter has still a role, but not for majority of the cases. Coming out of the ablation therapy, going back to our sudden cardiac death talk, we have discussed a variety of heart rhythm problems. We have discussed the coronary artery disease. We have discussed inflammation of the heart, myocarditis, causing this trouble. Another common condition called hypertrophic cardiomyopathy, where the heart muscle becomes very chunky or very muscly, and that is causing obstruction to the flow of the heart. And this obstruction of the flow of blood can impair blood reaching out to the brain. When muscle get very chunky, it can cause abnormal blood supply to the deeper tissue inside, and that can degenerate, or when they get deprived of blood flow, they may die. When they die and form a scar, they create abnormal heart rhythm, and the higher amount of the scar in that, higher amount of risk you are carrying of developing this kind of heart rhythm problem. And therefore, based on certain specific criteria, we deliver them defibrillator. It is just kind of a pacemaker as we discussed before, but it can be life-saving if you develop abnormal heart rhythm. It can save your life when you are sitting down on the river bank, or when you are trying to climb a mountain, or when you are spending time with a family on a holiday. This device has longer battery and provide you durable safety. But beyond that, when it's keep blocking the blood flow, there are various ways we have developed to attend the problem by shrinking this muscle, by delivering some specific therapy called alcohol septal ablation. where we inject alcohol, irritable chemical inside the blood vessel and destroy the tissue which are not needed. There is another therapy called septal myomectomy, where we shave off the extra tissue on the inside of the heart, which can allow enough blood flow to be restored. Beyond hypertrophic cardiomyopathy, certain number of patients who have weakened heart with thinned out walls without any obvious reason. Many times this has happened due to any viral infection, but many times we don't know what causing this. It can be genetic. It is called dilated cardiomyopathy, where the weakness in the heart muscle causing increased size of the chambers, and that is promoting abnormal heart rhythm. Chances of that is smaller at times compared to any individuals with ischemic heart disease, where the blood vessel blockage is a problem. But yes, it can still be a reason to cause a problem, and that needs to be attended as well. If you have any of such concerns or you want more information on any of this situation, we can always provide you some kind of support which will provide a better health in general.